We are pleased to offer in our practice Insignia, which is a custom orthodontic appliance manufactured by Ormco Corporation. Dr. Sarver's had the distinct pleasure of being involved in development of this project over the past decade and has got to enjoy its development from infancy to where it is now. Let's start off with an example of the problem that we're trying to deal with. This is a young girl who moved to Birmingham and moved into our practice. When you look at her smile, it looks nice, but there's some things about it that aren't quite as good as we would like to see. What would that be? Well, first, when we look at the lower lip line, it has a nice curvature to it, and when we look at the curvature of the occlusal line, or the upper teeth, they are a little flatter than that curvature of the lower lip, which is one of the objectives of smile design, is to show a parallelism or consonance of those two arcs. The smile attributes that this patient has is that she doesn't show all of her upper teeth when she smiles, and as we get older we show less tooth, so this is a smile that's slightly older than it needs to be at this point in her life. Again, the lower lip curvature compared to the upper occlusal line, that is what we call a flat smile arc. Well, the brackets are placed here, and they're in the normal place that we put brackets, and this is where the thinking begins to diverge from normal orthodontic bracket placement, that we normally put the brackets in the middle third, vertically and horizontally, and that's exactly where they got put. But what we want to do is rethink this. Because we don't show as much upper incisor as we would like, as depicted in the upper right, what we'll want to do is identify the teeth and place the brackets a bit higher in order to bring the upper teeth down and put them into the position that we want. Well, the question would be, how much do we need to put those brackets more superiorly? Well, do we measure it? Can we eyeball it? How do we do that? Well, admittedly in this case we had to eyeball it. Looking at the before and after, the changes are fairly unremarkable until we look at the before and after smile. This is our patient's smile before and her smile after, and notice how much more tooth she shows, how much more youthful that smile appears. Close up, healthier, more youthful smile. Well, Insignia appliances. This is a young man who has crooked teeth, bites pretty good, but he's got significant crowding, and an impression of the teeth is made, and the impression sent to Ormco, and a CT scan is made, which creates a virtual 3D replication. We also are able to translate further into treatment by designing the shape of the arches which we want, and that means that we have taken that scan and we can alter the shape of the arch for the type of smile attribute that we want, and arch wires are custom manufactured. This is done in this manner. Each arch wire is then cut and custom fitted to the exact arch shape that we design here in the office to match the specific treatment goals that we want for your child. Well, individualization of the bite is also possible. We have an interactive interface which allows us to tip and move up and down, move the teeth wherever we want to. And the next thing is that smile arc we're talking about. We want to be able to adjust that and visualize the placement of the teeth and move those down some, and you notice that that changes that curvature just a bit so that we can match that occlusal line and get the better smile than we might have started out with. Well, here's the patient's before and after. We have reset all the teeth, and the blue is, or the green is where it started, and the white is where we ended up. And that shows us that in this particular case we didn't have to change the vertical position of the anterior teeth at all. The custom brackets are then cut according to the programmed toric angulation, all the other values that we build into each bracket. And then the blanks are milled. And notice that the plate moves up and down, in and out, and at different angulations specific to the prescription that we have made. Well, we want to go back to how do we relate that bracket setup we've done on the computer to the smile. And the answer is coordination of 3D model to the smile image, which is in the works for us to bring the teeth into the face in 3 dimensions. Once the appliances are manufactured, we do what we call an indirect placement, where this kind of specific placement is requiring a much more specific method of bracket placement. So this is how the brackets arrive from the factory for us to place on the teeth with light cure composite, like so. So we look at our patient at start, and here he is 8 weeks later. Things have moved much more rapidly because of the custom nature of the appliances and the wires. So here's our finished smile, finished bite and intraoral relationships, our permanent